episode, Ambika is going to share her physical therapy expertise and chat about the empowering benefits of physical therapy for seniors. I'm your host, Michelle Beatty, professional development author and coach. Ambika, welcome to the Career Tipper podcast.
Hi, Michelle. Thank you for having me as a guest on the Career Tipper podcast. How are you today?
I am fantastic. Thank you so much. And I am really excited for you to share what was your journey to choosing physical therapy as your career path?
So my journey to becoming a physical therapist started quite early. When I was about 5 years old, I was fortunate enough to have my maternal grandparents move from Sri Lanka and live with my family in Fort Myers, Florida. The interaction with my grandparents and caring for their medical needs as they aged intrigued my interest in pursuing a career in the allied health sciences. I also had an early exposure to the medical field since my father is a physician. By the time I was 14, I knew that I wanted to get into some aspect of the medical field. And during my 4 years of high school, I was fortunate enough to get accepted into a program called Project Youth. And this was a scholarship program for high schoolers who had an interest in getting into the allied health sciences. Through this program, I was able to observe and help physicians, nurses, and allied health professionals with their patient care and watch that careful interaction between the medical personnel and patients. So when I got to college, my major was movement therapy, in which I took several courses in kinesiology, anatomy and physiology, and these were all related to physical therapy. I also had a keen interest in sports and played some soccer and competitive tennis and enjoyed other racket sports such as ping pong and badminton. So eventually I was able to combine my two passions of sports and helping others through their injuries into this profession of physical therapy.
Love it. Now, you've been in business several years now, and you have successfully grown your brand. So what are like a few business operations best practices that have contributed to your success?
So, Michelle, I have, since I have a mobile business practice, I provide physical therapy in the comfort of people's homes. Therefore, customized patient care and rapport are crucial elements in this field. Other areas that have contributed to my success are attending and volunteering at community medical events. I also enjoy networking with other business practice owners. I have participated and attended races in Manhattan and New Jersey, including the half marathon in Brooklyn, which I did about 2 years ago. I also have volunteered at senior community centers, and I plan to do some therapy-related workshops and small group exercise classes in the beginning of 2019. My practice has grown through word of mouth, and majority of my clients letting their doctors know about my practice. Accepting various insurances has also been a contributing factor to my success, as it made it easier for people to have access to therapy.
Okay, so you creatively incorporated Pilates into your rehab therapy. And like, what other fitness systems do you encourage fellow physical therapists to practice or become certified and to assist providing quality service?
Yes, I do incorporate mat Pilates exercises and stretches into my rehabilitation program. And I feel that it's very helpful with my patients' recovery. I think yoga and Tai Chi certifications could also be beneficial for physical therapist practice. Being familiar with these forms of exercises will allow the client to progress from a rehabilitation program to a community wellness program. These forms of exercise is also mild and gentle on the body, and at the same time, they will strengthen and tone the muscles.
Your service focuses on geriatric and orthopedic-related injuries. You've witnessed a variety of scenarios. What are some challenging factors you encourage families to be mindful of when it comes to their beloved seniors that don't have a nearby support system?
Yes, Michelle. So this is an area that can be challenging for the patient. In a recent study of health.com, older adults who were extremely close with family other than their spouses had about 6% risk of dying within the next 5 years, compared to about 14%. And among those who said they were not close to their family, it also was noted that people who weren't close to their family had a greater risk of suffering from a heart attack or a stroke. So pretty much from this article, we can actually see that social relationships do matter as we get older with our friends and family. Many times, a lot of my clients don't have a close family support system, or their families are far away and they live in another state. So this can be challenging for the patient emotionally, physically, and even medically. I've noticed that the patients of mine who have a strong or close relationship with their families tend to heal better and also have less injuries and falls. Most of my clients that do thrive and do better usually have a close relationship with their children or their siblings, or have a tight-knit support system that can check up on them on a daily or weekly basis.
As they age, many seniors are sometimes concerned about how they're perceived in the community when it comes to relying on assistive devices. Please share your thoughts when it comes to this.
So 80% of my practice is focused on seniors, and the majority of them are over the age of 65. So one of the biggest concerns that seniors have is losing their independence quickly and having to rely on that assistive device for either their balance issues, some of them have decreased endurance, or even for community ambulation. Many seniors simply don't do as well as they did when they were younger. And this is because as we age, our senses and reflexes have diminished and slowed down. So the use of these canes and walkers compensate for these senses by helping the brain realize where the body is and where the feet are going. A lot of my clients associate these devices with weaknesses, aging, and dependency. And this is one of the last things that elderly people want to be associated with, especially as the realities of getting old become more intrusive every day. Many times my clients also feel more comfortable utilizing a push cart or a shopping cart to run these errands instead of using their walker or rollator or a cane. So my biggest argument in trying to convince my senior clients is that a cane or a walker doesn't limit you, but it can allow you to be more independent, and it also allows you to ambulate a further distance in the community without having to depend on someone else. So overall, I do feel that mobility aids allows people to stay active and also engage in their social activities and events that they want to participate in.
Okay, that's awesome. Now, Ambika, how do you suggest families and caregivers dismiss shame and embarrassment when seniors ask and recognize that they need assistance with activities of daily living?
As I mentioned earlier, some of my clients' families live out of state or have busy work lives, and some don't have family at all. Many times, I recommend various agencies that provide this kind of help with their regular activities of daily living, also known as ADLs. And the ADLs are based on 6 main categories. And these are bathing, dressing, toileting, transferring in and out of bed, continence issues, which is like able to control your own bowels, and also feeding. There is another category of IADLs, and these are independent activities of daily living. And these are paying your bills, cleaning the house, cooking food for yourself, and being able to transport yourself outside of your home and socializing. A greater portion of the United States population is due to the baby boomer generation. This is the period between 1946 to 1964. And in 1985, seniors took about 12% of the population. And currently, there are about 13%, which is about 40 million people. And by the time we reach to 2050, that number is going to increase to about 80 million seniors living in the US. You can imagine that. This will require, of course, a great deal of decision making for a lot of families on when and what kind of care that they're going to need for their loved ones. Luckily, there are plenty of options. Some places that to consider are assisted living care places, nursing homes, home health care, independent living communities, and also hospice care if needed.
That's sobering from a standpoint of, people are living longer, which is fabulous, but I think sometimes people don't really factor in the need for long-term care disability, or the fact, they're not necessarily end of life, but making sure the quality of life is in place.
That's correct.
For them to be able to, retain services like yours and just that quality of life. So it's just very food for thought, not necessarily for maybe someone listening, but maybe for someone that they love that's going through the aging process, and what does that mean and how are they going to contribute to that, or make sure necessary systems are in place for them to continue on. So thanks for sharing those stats. That's awesome.
Sure.
Now, why is it important for working professionals and seniors to continue home exercise programs or physical therapy exercises after their initial sessions to maintain their strength and mobility? Because sometimes people are like, I'm good. I finished my 5 sessions. I have my stretch bands and, the tennis ball to roll their foot around or something like that. So what's your feedback on that?
Yeah, I get this all the time. Well, one of the things that I do after my initial evaluation is I usually come up with a customized home exercise program. And this is based on the client's needs. And this program consists of exercises with pictures or illustrations for the client to practice at home. And these exercises I usually update through their whole course of their care. And one of the things is I'll usually get a lot of clients trying to find any kind of excuse of not to do these exercises. But what's important is that to continue home exercise programs once you're discharged from PT, because this reinforces what's completed during each visit. And it also transitions that client to pretty much be independent after we're done with their physical therapy. And some of the benefits that I've seen in clients that adhere to their home exercise program is you regain your function sooner, you relieve the pain quicker, and sometimes it can be a new active lifestyle that you've learned and want to continue in your program, in your life. And most importantly, it's essential to continue the exercises once discharged from PT, so you help to avoid reoccurrence of that same condition. So I don't hopefully get to see them again the next year for that same problem.
Understood. Now, what wellness routines and activities do you practice to maintain your own health and fitness?
Well, as a physical therapist, I think it's important to stay healthy and to be active. My wellness routine involves a lot of different activities. I enjoy walking, running, hiking, strength training, and I also play racket sports, such as tennis. And I've always been physically active and enjoy the outdoors. I also think it's healthy to take mini vacations because we all need to recharge our minds and bodies from our everyday lives. I think it's also pertinent for all of us to stay physically and mentally active as we get older. Diet is also a crucial element to rehabbing successfully. It's very important in preventing and flaring up any kind of inflammatory conditions such as rheumatoid arthritis. And it's also essential to hydrate our bodies with 6 to 8 glasses of water a day. I do realize as I also get older that there is more wear and tear on my joints and muscles. I also think that it's important for me to set an example for my patients by staying physically active and engage with these exercises. One of my main mottos is you're never too old to exercise. The most important thing is just being physically active, and that could be various different things. Sometimes like taking the stairs instead of like not using the elevator, also dancing. Sometimes people enjoy any kind of movement that you can do every day. Even household chores is a form of exercise. So I think all of these could be very beneficial. It's not like you have to go to the gym and work out there.
Please share a now cherished life lesson that your work with seniors have gifted you.
Well, like I mentioned earlier, growing up in a Sri Lankan household, I was fortunate enough to have my maternal grandparents live with my family. And several years later, my paternal grandmother also moved from Sri Lanka to Florida. So through them, I was able to learn a lot about my culture and appreciate these moments that we have with our families and also with our friends. And also listening to their stories and experiences in life. My maternal grandparents have both passed away, but they lived until they were 87 and 95 years old. And my paternal grandmother is currently still living, and she is 99 years old, and she's very active with her walker, and cognitively she is quite alert. As a physical therapist, I have a soft spot for seniors, and I'm also able to empathize with them better through my exposure to my grandparents. After working with many seniors, I've also realized that the elderly are never done teaching you with something that you can carry for the rest of your life. So I've also learned that it's important to enjoy life every day. My grandmother always said, don't worry about what you don't have, and to be sure to appreciate what you do.
So what are some physical therapy or home exercise programs that you encourage the listeners to check out?
Well, some physical therapy home exercise programs I recommend is HEP to Go, PT Pal Pro, and My Rehab. These are all apps you can download on a smartphone. And some podcasts that are great to listen to are Healthy, Wealthy, and Smart, PT Tech Talk, and Senior Rehab Project.
Thank you for those shares.
Sure.
Yeah. Now, Ambika, I appreciate you being a guest on the Career Tipper podcast, and please share your favorite quote or affirmation. It's just the way we end every episode. Like, what keeps you creating career tipping moments?
Well, thank you, Michelle, for having me on your show. And I'm going to close with two quotes, one personal and one physical therapy related quote. My favorite PT quote is, motivation is the art of getting people to do what you want them to do because they want to do it. And this is by Dwight Eisenhower. I found that this quote pertains a lot to my clients because many times I have to motivate or push my clients to do their exercises. And when I make it seem like it's their choice or idea, they seem to be more compliant. And my personal favorite quote is, if you're always trying to be normal, you will never know how amazing you can be. And this is by Maya Angelou.
Love it. Love it. Now, please share with the listeners how they can get in touch with you.
Sure. You can reach me at devaphysicaltherapy.com, which is my website. And you can also, I'm on Facebook as well at Deva Physical Therapy. And my email address is devaphysicaltherapy@gmail.com. And that's all one word, DEVA Physical Therapy.
Fantastic. And you can find me, Michelle Beatty, at careertipper.com and on Facebook and Instagram at careertipper and Twitter at careertipper1. Please listen and subscribe on iTunes, Spotify, Stitcher Radio to the podcast. And if you enjoyed this episode or any other episode, please share a 5-star review on iTunes. Thanks so much for joining us today.
Thank you for tuning in to this episode of the Career Tipper Podcast. We're grateful for our listeners and guests. For more resources about how to evolve to your professional best, share your comments and feedback about this episode and your suggestions for future guests, visit careertipper.com. Until next time, be confidently you.